Hello, hello. Here we are, Volkmar chapter 8. Pretty straightforward reading. Love the Volkmar texts. Let's see, this is working with school-age children. Our Zager lecture had to do with preschool age, early intervention, and now this is school-age children. So, essentially, hopefully you learned this from the previous lecture, but we know that from preschool, in preschool, the early diagnosis and intervention are associated with better outcomes for individuals with autism. And so when we see students coming into school age, right around first grade, that sort of thing, you will see major differences. There's going to be some students that have made substantial progress, and there will be some students that continue to have significant challenges. So although early intervention can do wonders and does do wonders, we still see varying ranges of disabilities as students come into school age. When I had my school in Michigan, I remember, well, there's one student that I worked with, and he, I think I told you actually, but we had him for a couple years, less than a couple years, and he went into regular kindergarten without any diagnosis. So the kindergarten class that he went into, his kindergarten teacher didn't even know his history, didn't know that he had been on the spectrum and been in intensive early intervention for a couple years prior. So now he still has some oddities in terms of his behaviors and interactions, but undiagnosable. So on that end, you have a student like that, and then on another end, I have one student that I still think about all the time because we just made so little progress with him, and I left the school before he entered kindergarten, so I'm not sure where he is today. I should probably look him up. I bet I could find his mom. Anyway, I just think about him because he still, at the time that I left, didn't have any language, really engaged in stereotypy most of the day, hand flapping and jumping, and continued to kind of just be in his own world. So just thinking about those two different students heading into school, the differences in terms of the spectrum. Let's see, so students on the spectrum, because of the oddities and social isolation, contributes to further isolation in school as, as the social piece comes into play and peers and friends and all that sort of thing. Kind of the factors that contribute to this we've talked a lot about, but students on the spectrum have problems in play, in making friends. They have unusual patterns of interest and behavior and unusual language and communication patterns. So all these kind of play into further isolation in school age. Also keep in mind that downtime, lunch and recess and transitions and PE and all these sorts of times really can be the most stressful for students with ASD. They typically do a lot better in those structured settings. So something to consider. So the text breaks it down into a lot of different areas that would be the focus during school age. The first is social skills and social style. And first, what we've learned early on, if you remember that eye tracking research, where researchers would look at individuals with ASD and track their eye movement in watching movies and social interactions and that sort of thing, and basically found that they're not looking at the eyes, and so just based on where students with ASD are typically looking, they're missing a whole lot in terms of social interaction. There's some research, we and colleagues, they identified basically 3 styles of social interaction of individuals with autism. And you can, obviously students range and vary and that sort of thing, but typically can kind of fit into these 3 different areas. One is aloof, and that is the students that are in their own world and do not have any motivation to engage socially, and when they're required to, they find it very aversive and have tantrums and that sort of thing. Passive is exactly that. They really don't have any interest, but they'll kind of go along with whatever's going along. And then there's active but odd, the students that really do want to engage socially, but do so oddly. And that's typically those higher functioning individuals with autism and Asperger's. And because those students are higher functioning, have higher cognitive abilities, they recognize that they're different, and that often results in depression and distress. And this is kind of a major theme throughout this chapter. It pops up in every area of instruction and focus for individuals on the spectrum as school-age students. Emotional development. Essentially, it's just highly idiosyncratic. I mean, basically, they might take pleasure or displeasure in things that are completely opposite from a typically developing individual, and so this does stand out in school setting. Also, one of the things is that they might say things that are true but are very hurtful, and really have little understanding or appreciation of why it's hurtful, or why they can't tell the truth, why they can't say what they think, and that sort of thing. My brother, he worked for the Ann Arbor News for about 20 years, and Ann Arbor News shut down. A lot to do with online reading and that sort of thing. But anyway, so he decided it was a good opportunity to actually go back to school and do what he had always wanted to do, which was be a teacher. So he's currently in a master's program and getting certification and gaining certification in special education. And so he's been subbing in a bunch of different schools across the state of Michigan, and he kind of got a long-term placement in a EI self-contained classroom, and there's a student in there that has Asperger's, and my brother sends me texts almost every other day telling me what the student said, and we always laugh. I mean, you know, we're not laughing at the student, we're laughing because what he says is often very true. A lot of times he's making fun of my brother and calling him out on things, and it's just really interesting because my brother is gaining an appreciation for the individuals on the spectrum, so it's always fun. Play. By the time students are coming into school age, they have probably acquired some play skills. Hopefully they have, and these can basically be supported and expanded upon. There's lots of different ways to do that. We've talked about some of these, but teacher-directed, peer-focused, behavioral reinforcement techniques, modeling, scripts, all these sorts of things that you can do to encourage and expand upon the play skills. Language and communication, here we are again, right? How many times are you going to hear this? This is only a first class in the program. We know that having some language by the time the student enters school is definitely an indicator of better prognosis. However, even with minimal language, we can still make gains. Obviously, those gains are possible and obviously desirable, so it is a major focus. The main reason is that, I mean, language in and of itself is important, but improved language levels also relate to better social skills, fewer behavioral problems, and more personal independence and self-sufficiency. Kind of the areas of focus that continue to be problems when we're talking about language. So if a student does engage verbally, we still typically have to focus instruction and intervention on echolalia, pronoun reversal, which I don't understand how anyone as a young individual learns how to use the proper pronoun. I've seen it happen in my daughter, and I just don't even understand. I remember as she was about 1.5, she started properly using, you know, I and you and me and her, and I couldn't believe it. It's so, because typically if you think about it, if a student or a child repeats what has just been said, it's going to be incorrect. So if I say, do you want it? And she says, yeah, you want it, then obviously it's wrong. So anyway, it's a really hard one. It's a really tricky one, and it continues to be an issue for students on the spectrum. Prosody and register, we've talked about that many times, the tone and the volume of language, and pragmatics of carrying on a conversation that's two-sided and interesting and that sort of thing. There's also an issue, this one we haven't talked a lot about, but the ability, students on the spectrum really lack the ability to tell stories and narratives, and your text just kind of mentions Storybook Weaver program as one helpful resource for teaching individuals to do that. Sensory and behavioral issues. Well, of course, stereotypy and repetitive behaviors are common. That's how they get on this, get the diagnosis. They are engaging in those behaviors. We do find that they are somewhat less common in adolescence. However, a lot of times those behaviors will continue into adulthood. We do see that they are somewhat more common in students with lower levels of cognitive ability. And a lot of people want to compare it to OCD, obsessive compulsive disorder, but those are very different. They might look the same. The student is, obsessed with certain behaviors and engages in them a lot and that sort of thing. But one way to think of it, which I think is helpful, is typically someone that's engaging in OCD is very troubled by it and doesn't like engaging in those behaviors, and would like help in not doing those. Individuals with autism or on the spectrum typically love the behaviors that they're engaging in. Those are very comforting and make them happy to do that. So that's one big difference. If the behaviors are interfering with learning, then those can be targeted for medication or behavioral intervention. Now, what I just want to say about that is a lot of times when families would come to me, we'd be starting a child in our school, we would talk to the parents and ask what their priorities were for teaching skills and reducing behaviors and that sort of thing. And as I've mentioned, parents are typically interested in potty training and language, but also reducing the stereotypy. They say it's embarrassing, they can't go out to dinner, they're in the grocery store and people are looking at them and that sort of thing. But that's not, in my opinion, the best reason to want to reduce those behaviors. If we want to reduce those behaviors, it's because it actually is interfering with learning. And a lot of times what I've done is allowed those behaviors to occur as a reinforcer. So sometimes if I could get a student to, say an approximation of a word that I was trying to teach, and he got out the approximation, then I'd let him have at it with his jumping and flapping for a second. And then I'd go back to instruction, and his reward was the stereotypy. So anyway, just wanted to comment on it. Gender differences should be noted. We've brought up the fact that ASD is occurring a lot more in boys than it is in girls, about 3 to 4 times higher in males than females, with the exception of Rett's, of course. Girls, when we do have a girl on the spectrum, they typically have more severe cognitive problems, and girls that have a diagnosis of Asperger's typically have even more trouble than boys fitting in. They're more anxious, kind of stressed out by those social demands. And there's the issue of personal safety, and this doesn't come up a lot, but it's very important, and it's not just with girls. It's kind of interesting that that's where they put it, but it is more so with girls, but it's important for girls and boys and across disabilities. But the idea of personal safety and sexual abuse and that sort of thing, especially if you're talking about individuals that are nonverbal, then they don't have a means to communicate that abuse is taking place. Dr. Harold Johnson, he's in our special education, he's faculty in the special ed program at MSU. He was in the deaf education program, and he's actually taking over a lot of courses in the undergrad program. But anyway, he does a lot of very important research in this area. Obviously, he his area is deaf ed, and so these individuals oftentimes typically don't have language and don't have a means to communicate, and so there's a lot of abuse that happens, and so this is an important one. Something that what I need to do is look up some resources that would be helpful, but things to identify, to look for, signs to look for, to be conscious and aware, kind of looking for those signs and signals. But anyway, girls, it's listed under the gender differences for girls for personal safety. Academics and curriculum, well, goodness, it just depends, right? What's appropriate varies from child to child. Some you might have a regular program with some modifications. Some you might have smaller teaching setting that might be more helpful. It really just depends. There's really no simple one-size-fits-all bit of goals for academics and curriculum. I don't know what one-size-fits-all anyway is, right? I mean, I'll tell you what, my t-shirts that said one-size-fits-all, second pregnancy, 9 months pregnant, coming off a fourth pregnancy, sorry, that's confusing. I've been pregnant 4 times. I have 2 children, but yeah, one size fits all wasn't working at that point. So I can only imagine one size fits all doesn't work for academic and curriculum goals either. Now, the goals that we typically target, though, social interaction, expanding communication, your traditional academic goals, those are the main emphasis areas for school-age individuals on the spectrum. And there's some text in that kind of shaded gray area on page 243 and 244 that should be helpful for you to take a peek at. It talks a little bit about computer technology as intervention, and it's just noted that, technology is not a replacement for effective instruction. Just because you got some computer programs going doesn't mean that that's effective instruction, but computer technology can be very helpful. Yeah, actually, at the bottom here, I talk about literacy, and so I'll tell you about a computer program that I've used that's pretty helpful related to literacy. But anyway, your text again says, do not underestimate visual schedules, pre-teaching, using lists and checklists and charts and all those sorts of things. So even if you don't have access to high-end technology, these interventions are very helpful. And you can always use incidental teaching, especially around that topic of interest for the student. If you have someone with Asperger's and they have a particular interest in, dinosaurs, then you can use incidental teaching to teach your academic goals related to that. Small groups can be really good learning environments for individuals on the spectrum, but group work needs to be monitored and structured. Talks a little bit about hyperlexic. Essentially, some students on the spectrum are very interested in letters and numbers and words and have advanced reading skills for their age and that sort of thing, but they actually have very little comprehension of that reading, so it's just an important thing to be aware of, to check for, and obviously develop goals for instruction if that happens to be the case. Literacy, making sure that there's availability of books. That one always kind of bothers me. Just because there's books around doesn't mean that kids are going to pick them up and start reading them. Now, maybe typically developing kids, but I don't even know if that's the case. Right now, my daughter loves books. She just can't get enough. It's always at bedtime an issue of how many books we can read. My son, same environment, same growing up, and we have books around. All he does is eat them and tear them up. So anyway, that one's kind of irritating because especially typically developing students, just because you have a book around doesn't mean they're going to pick it up and read it, but especially students with disability doesn't mean they're going to pick it up and read it. But of course you have to have them around, have to have some books. You might have some word processing programs. Make sure there is time to read, that time is available. encouraging reading literacy skills, and I added explicit teaching. It's an important component. So actually the computer program that I've used a whole lot, it's used very extensively with the autism population. I've actually used it with my daughter to teach her to read, but it's called HeadSprout, and there's a ton of research on it. Actually, one of my good friends that we did our master's program together, and we started out at Columbia together. She actually left Columbia, went to Seattle, and started working for HeadSprout. And so I'm really familiar with the research behind that program, but it's very effective for teaching reading. Spelling oftentimes can be a challenge for individuals on the spectrum. You know what's really interesting? Right when I read that, I just happened to, a student that I've mentioned before, her name was Lauren, and she is the one that I told you used to engage in echolalia, right? That was, didn't matter what it was, she could recite everything that she had heard on TV the night before and that sort of thing. But interestingly enough, I'm friends with her mom on Facebook, and her mom just posted that Lauren had won her class spelling bee. I couldn't have been more proud. When I had her, she was about 4, and oh my gosh, I cannot believe how long ago that was, but that was about 11 years ago. So she's about 15. So middle school, high school, winning her class spelling bee. I was super excited about that. I still remember the word I missed in my class spelling bee. 6th grade, I think it was. It was the only one I was in, but I spelled special wrong. And I was excited because I thought I knew how to spell it, but I said EL at the end and it was AL, so I've never forgotten how to spell that word. So anyway, spelling can be an issue. Mathematics, skills and deficits related to mathematics can vary greatly, anywhere from savant calendar calculations and advanced equations and computations to individuals who really struggle, and touch math and peer tutoring and that sort of thing are helpful for those individuals. Your text talks about some teaching procedures and programs that are helpful for teaching. One is STAR, Support and Treatment for Autism and Related Disorders, and the other is TEACH, Treatment and Education of Autistic and Related Communication Handicapped Children. Both of those are really popular and pretty prevalent in the schools and readily accessible and that sort of thing, so if interested. Mainstreaming we've talked a bit about, but again, this is a large part of the chapter, and it nicely goes into the next section, which is bullying, which we'll talk a little bit about. But mainstreaming, part of the day, mainstreaming, at least some of the day, mainstreaming really provides important opportunities for positive peer interaction and academic success. If appropriate, if it's the best use of time, that sort of thing. Typically it can be pretty important for peer interaction. There's peer-assisted learning strategies, which is PALS, and that's it has a lot of research support behind it. It's an effective program for using peers. When you're thinking about peers, you really have to identify before I talk about peers, this areas, times of high level of adult support can be provided. Basically making sure that when you are going to mainstream, the best area and times of days to do that are when there's a high level of adult support. So it's not those ones that we've talked about that are easy to do, like lunch and transition and recess and that sort of thing. So if you are going to use peers, this is an important consideration in terms of identifying the peer that will help assist the student with ASD. But basically you have to consider the motivation and interest of that peer and how much support and supervision is going to be needed of that peer. And really they can do anything from walking the student from one class to another, helping with homework, being their buddy on the bus, reviewing lessons or course content, sharing their materials, helping with communication. So really in every area that you can imagine. And the thing to consider is that peers can be really helpful during those times of the day that are the hardest for students with ASD, which are those downtime, open, unstructured periods of the day, lunch and recess and transitions and PE oftentimes. Now, one consideration that's important when we're talking about peers and paraprofessionals, any kind of support for the individual on the spectrum, is that it's a delicate balance, right, of providing support but not too much support. I've been in classrooms where paraprofessionals are really helpful and really excited to be helpful and are a bit overzealous and do everything for the individual with ASD, and so that doesn't allow independence. It also is a bit off-putting to all the other students. It's hard for an individual on the spectrum to appear, typically developing and interesting to all the other peers when they have an adult hovering over them and shadowing them the whole time. So it's an important balance and consideration when you are providing supports. And essentially, unfortunately, if you're going to have individuals on the spectrum mainstreaming, then you do have to consider the possibility that bullying is going to take place and at the very least teasing. So, students on the spectrum just have a lot of difficulty in reading those social cues, dealing with fast-paced social instruction, and so they're kind of a target for bullying and teasing, right? And basically the factors that kind of play into that are there's already social isolation and awkwardness, and they're a bit eccentric and oftentimes appear self-centered. So all of these factors related to having, autism spectrum disorder then kind of makes the student stand out and become a target for teasing and bullying. It may be isolated events and it may be ongoing. The issue is that it really results in a lot of stress. It might result in aggression of the individual on the spectrum. Depression and anxiety, I'm telling you, are so prevalent for those higher functioning individuals. That's typically what they are seeking counseling for as adults, is depression and anxiety related to all these social issues. But bullying and teasing in particular will result in stress, aggression, depression, anxiety. And one thing to kind of look for is that students that are being teased and bullied may start to just melt down at the most trivial event, and it's kind of an indicator that there's other big stressors going on, and you might look into bullying and teasing as being one of them. So I think that's pretty much it for this chapter. I gave you the option